Hello and welcome to Pregnancy Info. Today we are going to discuss all about cervical cerclage. Cervical cerclage is a way of keeping your cervix closed during pregnancy to prevent premature birth due to incompetent or weakened cervix. If your cervix has weakened, your healthcare provider will likely recommend a cervical cerclage. This is to keep your unborn fetus safe inside of your womb until it's time for you to give birth. Cervical cerclage is a way of keeping your cervix closed during pregnancy to prevent premature birth due to incompetent cervix. During this procedure, your healthcare provider will place one or several sutures or stitches in the opening of the cervix to keep it safely closed during your pregnancy. Your cervix is the lower portion or opening of your uterus. Your uterus is like a pouch or purse, and a cervical cerclage procedure is like string that keep the purse closed. Why is cervical cerclage performed? There are several reasons why your healthcare provider may recommend cervical cerclage during your pregnancy. Some reasons for cervical cerclage include incompetent cervix. This can happen due to past surgeries such as LEEPs procedures or other surgeries on cervical tissue. Past miscarriages from an abnormal shaped uterus or damage to your cervix. Past miscarriages during the second trimester that suggest weakened cervix. It's important to discuss with your healthcare provider any past pregnancies, miscarriages, and procedures you have had. If your healthcare provider thinks you may benefit from a cervical cerclage procedure, they will perform it at about 12 to 14 weeks into your pregnancy before your cervix thins out. What happens before a cervical cerclage procedure? Before your cervical cerclage procedure, your healthcare provider will go over your health history and discuss with you any past complications from pregnancies or surgeries you may have had on your cervix. They will examine your cervix prior to the procedure by placing a speculum inside of your vagina so they can see your cervix clearly. Similar to when you have a routine Pap exam, they may also do a transvaginal ultrasound. Your healthcare provider will likely ask you to abstain from sexual intercourse for a week prior to your procedure. It's normal to feel nervous or have questions before having a cerclage procedure. During this time, it's a good opportunity to ask your healthcare provider any question or talk through any concerns you may have. During your cerclage procedure, you will lie back on your examination table with your legs open and both of your feet in stirrups, similar to when you have a vaginal exam. Your healthcare provider will give you some pain-numbing medicine, such as a local anesthetic, so you won't feel any pain or discomfort during the procedure. You may feel a small pinch when the needle is inserted into your cervix to numb it. After the anesthesia takes effect, your healthcare provider will stitch your cervix closed with strong sutures, tightening it until it's secure. The question is that this process is painful. It's normal to feel some cramping and light bleeding or spotting for a few days after this procedure. You shouldn't feel much pain after having a cervical cerclage procedure, no more than an average menstrual period. You can take acetaminophen to ease any cramping or discomfort. If you do have intense abdominal cramping or pain, call your healthcare provider right away. What happens after this procedure? After this procedure, you will stay at your healthcare provider's office or the hospital for a couple of hours to make sure you don't have any complications. You will go home the same day. Your healthcare provider may give you an antibiotic to take to prevent any cervical infection. You should plan to rest the day for your procedure and not attend school or work. Your healthcare provider will want you to allow plenty of time for your stitches to heal, about 10 days before you engage in any strenuous exercise or sexual intercourse. It is important to follow your healthcare provider's aftercare instructions and keep any follow-up appointment so they can monitor your pregnancy. There is some advantages of cervical cerclage. It's always wise to thoroughly discuss with your healthcare provider your options if you are at the risk for preterm labor, but if you have a weakened cervical or cervical cerclage procedure is the best way to prevent preterm labor. labor that begins before 37th week is called preterm labor. Here are some risks and complications of having a cervical cerclage procedure. Your healthcare provider will only recommend a cervical cerclage procedure if the benefits outweighs the risk. But as with almost any medical procedure, there are some risks to be aware of the cervical cerclage procedure. These include infection, damage to your cervix, bleeding, premature rupture of membranes. This means your water bag breaks before it should. Your baby rests inside of your uterus in amniotic fluid, also called bag of water or membrane. That rupture of your membrane could trigger preterm labor. Preterm labor is another risk. Cervical stenosis means permanent narrowing of your cervix, scar tissue on your cervix, tearing of your cervix or uterus if labor progresses while sutures are still intact. Here are some precautions you should take after cervical cerclage procedure. Abstain from sexual intercourse or inserting anything inside of your vagina such as douches or other feminine product. Take it easy. Refrain from strenuous exercise or lifting heavy object. Now, you should know that when is a cervical cerclage removed, your cervical cerclage will stay in place until your pregnancy reaches full term or about the 37th week of pregnancy. When it comes time to remove your cerclage, you follow many of the same steps as when you had your cerclage placed. Your healthcare provider will remove your cerclage in their office, where you will lie back on the examination table with your legs open and both of your feet steered up, similar to when you have a vaginal examination. Your healthcare provider will remove the stitches from your cervix. The removal procedure should only take a few minutes. Your cerclage can be removed sooner if your water bag breaks or you go into labor. Now, you should also know that when to call a doctor. Call your healthcare provider right away if you experience any of these symptoms: a high fever over 100 degrees Fahrenheit or 37.7 degrees Celsius, contractions or lower abdominal pain that comes at regular intervals, foul-smelling vaginal odor or discharge, water breaks or leaking, excessive bleeding. It is natural to feel frightened or have questions if you need to have a cervical cerclage procedure. While it might be scary to consider cervical cerclage treatment, this procedure is successful in nearly 90% of cases. But people diagnosed with short or incompetent cervix in a pregnancy can have this condition in subsequent pregnancies. Talk openly with your healthcare provider about how to plan for a healthy pregnancy. Ask them any question you have and talk through your concerns. I hope I have explained all about cervical cerclage treatment or procedure. If you feel this video useful, then share it with your friends and family members and also subscribe our channel. Thank you.